Morning, Mayor. Mayors, thank you both for being here. All right, so we want to kind of balance it out. Maybe some people come over here. Like if your name's over here, you want to be on this side. All right. Matt, you want to be over on that side. Your seat's over there.
Well, so is Ted. So.
All right. All right. Well, good morning, everybody. Thank you very much for making time today. We're going to give you an update with regard to the state of Nebraska's response to the coronavirus. We've got a number of folks here which demonstrates that the state of Nebraska has a great team of officials that are working together to protect the health and safety of Nebraskans. You're going to hear from a number of these officials here today that are talking about what we're doing. Now, folks, I'm going to tell you, I expect this to last about an hour. So what we're going to do is I'm going to introduce all the dignitaries that we have here. I'm also going to introduce, as some of our folks here are talking, they're going to, as they speak, they will sit down and then we will call them back up to answer questions at the end. We're going to keep this press conference specifically focused on, on coronavirus. Okay, so just so we're all clear what the ground rules are. The order of speaking will be, I will go first, then we'll have Commissioner Bloomstead, then we're going to have superintendents from our various school districts. In fact, we're going to start with Dr. Cheryl Logan. We've got Dr. Jim Sutphin. We've got the Associate Superintendent, Matt Larson, Dr. Matt Larson. They will speak about their school specifically. Then we've got Dr. Jeff Gold at UNMC. We've got Dr. Gary Antone, who's our Chief Medical Officer in charge of public health. We've got President Ted Carter from the university. And then, of course, Brian Sloan, President of the State Chamber. Also with us in the audience, let's make sure I get everybody here. We've got Mayor Larian Gaylor Baird. We've got Mayor of Lincoln, obviously, Mayor Gene Stothert, Dr. Chris Cradiville from UNMC. We've got Dr. Melissa Polonick, okay, DC West. I'm sorry, how bad did I butcher that name? Polonick? Polonsick. Is that check? Yeah. It is. Okay. We talked about Dr. David Patton from the Learning Community. We got Randy Schmazel from the Metro Community College. Randy, where are you? Supposed to be here? Okay. We got Dr. Barry Hebrock, Elkhorn. Hebrock, thank you. Dr. Andy Rickley, Dr. Mike from Superintendent Papillion La Vista, Dr. Mike Lucas, Westside, Dr. Jeff Rippey, Bellevue, Brett Richards, Springfield Platteview Schools, Dr. Rich Barron from Gretna, Dr. Randy Gilson, Blair, Dr. Jim Sutphin, we already talked about, Dr. Mark Adler from Ralston. So you can see we've got a number of the superintendents that are here as well. So folks, as I said, we've got a great team of people who are working to keep Nebraskans healthy and safe. Now, what do we know about the coronavirus right now? Well, right now, we have 13 confirmed cases in Nebraska. Our Department of Public Health is tracking these folks, and we're tracing those folks back to how they got it. We know that the coronavirus spreads easily. It's a respiratory disease that is spread by people coughing, and that's why we've really told people you need to cover your mouth when you're coughing, stay home when you're sick, wash your hands often, all those public hygiene things that we've been talking about for the last couple of weeks. We know that from the experience, and we're very blessed to have the resource of University of Nebraska Medical Center here in our state because we've got the world-leading experts that have handled cases like Ebola, to the federal government came to, for example, to help quarantine other patients from Wuhan, China, for example, or other patients that we've had. So we've got the world-leading experts here in Nebraska to be able to help us deal with this. And what they've told us is the coronavirus can spread pretty easily as a respiratory disease. That about 5% of the people who get it will have to go to the hospital. And what we want to do is mitigate that spread so that we don't overwhelm our healthcare systems. Now, young people will actually weather this fairly well. Of the 1,700 cases that we have here in the United States, we don't have any pediatric fatalities that we know of. When we think about things like closing schools, what we're really doing is trying to protect the health of the elderly, their grandparents, for example, or people with underlying medical conditions, because those people are also at risk. So, for example, if you've got diabetes, pulmonary disease, respiratory disease, those sort of things put people at greater risk. But if you're young and healthy, you may not even know that you have it. You may be completely asymptomatic. You may have the typical profiles for somebody to get a fever, coughing, maybe a little bit of trouble breathing. So our goal is to make sure that we slow down the spread of the virus so that we don't overwhelm the healthcare system and can take care of those folks who are generally going to be elderly, generally going to have an underlying health condition, to provide them the care that they need. So that's the goal of all of what we're working on here. And you've got a great team of people who are all working together toward that end. Now, here at the state of Nebraska, again, with the advice of the folks at UNMC, here's how we're thinking about it with my team. We are looking to see when we have that community spread. We do not have community spread right now. What I mean by community spread is the people that we don't know how they got it, right? So public health is working very diligently with our cases to be able to trace back how those people got it. And it's primarily related to travel cases. You know, our patient one came over from the UK. So we know that that's how she got it. And so we're tracing all the contacts that she had, right, from the moment she got back in Nebraska. And it's similar for all the other cases we have. When we know somebody's got it, we do the profile of tracing it back and see how they got it. And they've been typically travel-related cases. Now, what we're trying to do is make sure that we continue to track all this. But there may be people that we can't track. There may be people that we don't know how they got it, and that's called community spread. Now, based upon the advice that we've got from UNMC, what we're trying to do is as we approach 1% of the population having the virus, that's when we at the state will make the decision to close down schools and large public gatherings. And we'll be obviously taking other steps leading up to that, but that's going to be the trigger that we have at the state to be able to do that. Now, until we have the testing to be able to really demonstrate when we're approaching that 1%, as a general rule of thumb, what I will be using is those cases that we cannot track. When we have 2 of those cases in Omaha, 1 or 2 cases in Lincoln, we will then make that decision to say schools need to be closed for 6 to 8 weeks. Now, as we look at the rest of the state, working together with Commissioner Bloomstead, what we've decided is if within an ESU, and of course Omaha and Lincoln are their own ESUs, within an ESU, if they have one of those cases that we cannot track, then we will shut down the schools there. We're going to use our judgment on this too. So for example, it'll depend on the type of case. If we've got a case, for example, that borderlines 2 ESUs, we may close them both down. But that's where we're going to have good communication about how we want to approach that. Now, organizations can be more conservative if they want. For example, and some of our school districts will talk about this, if you were just on spring break last week, and you know you've got kids traveling around the country, and we know our cases are travel-related, you may want to take a break for a week to give officials a chance, and basically those kids to stay at home to see if they develop symptoms. So schools or other organizations can be more conservative if they wish. But what I'm telling you is this is how we at the state are going to make those decisions. When we have those cases we can't track in a community, we will be closing schools for 6 to 8 weeks. That's our current plan. Now, just so everybody knows, that's our rule of thumb. We're going to use our judgment. We have other ways to kind of measure what's going on in communities. So, for example, public health already tracks flu symptoms. If we see, for example, a spike in flu symptoms but a decline in actual testing for influenza A or B, then we know that we may have more people in the community with that virus. So that is how we are thinking about it at the state with regard to when we are going to start closing schools and large public events. So I wanted to communicate that out so everybody understands how we, the state, are approaching this. Just so you know, we also have testing available right now. We've got the capacity for about 200 tests between the Public Health Lab and University of Nebraska Medical Center. Private health labs are also gearing up to be able to do testing. Dr. Antone can talk more about how this will work, but generally, if you think you've been exposed, we want you to contact your healthcare provider. They will do a screening and determine if you are a good candidate to get a test. And if then that would be the appropriate time to go get a test. But we want people to be screened first because there's still lots of flu, for example, out there, and the symptoms are very similar. But if you know, for example, you've been exposed to somebody who has tested positive for coronavirus, then that's a reason to be able to talk to your doctor and go get tested. So again, I want to emphasize we've got a great team here, represented by a lot of the people who are up here today or sitting in the audience. Again, I appreciate the mayors to be here to support the superintendents. Thank you very much. And we are going to continue to work on keeping Nebraskans healthy and safe. So with that, I'm going to go ahead and turn it over to Commissioner Blumstedt.
All right, thank you, Governor. Well, and thank you, everyone, for being here today. Obviously, it's a very unique moment in time and history. Quite frankly, if you look at where we're at, I don't believe any of us have experienced anything quite as disruptive as what coronavirus is. I wrote to my...
If you have, I want to know.
Yeah, we do need your experience then. But the reality is I wrote my staff today and talking about the foe that we have that we can't see. And that foe is coronavirus that creates the COVID-19 disease, right? That creates that. But we also can't see the fear, right? And so one of the challenges for us is balancing that. And by the way, that's the role of leadership as well. This leadership has worked very, very hard, and all of you have worked very, very hard. I think we've had regular conversations across the state about what we need to be prepared for. What we're preparing for is ensuring that our public services, our public schools, our private schools, all of our schools, all of us working together are ensuring the public safety. I know what our goals are in education, and what I can tell you, I get questions about, so what are you worried about on hours, Commissioner of Education? Don't worry about hours right now. Worry about your public good. Worry about the direction that you're going. I get asked, what about testing this year, Commissioner Blumstedt? I quite suspect there will be no legitimate testing that takes place across the state of Nebraska, and we're working on those calls. I get a lot of questions about what else do we do, how do we manage all of the environments that we're in. There are so many to manage that quite frankly, you're going to have to be able to manage those, with your best interest. So we wanted to be able to think about strategies where we're having a weekly conversation. I set that up last week where I invited all the superintendents of the state to be able to participate in that. That actually will be expanding in the sense that I've invited public health officials to be able to be part of those conversations so we can be informed as leaders about what's best for our communities. I've invited the governor, and the governor's accepted to be part of those calls as well. That will be a critical part of our discussion so we can keep people informed across the state. I'm asking ESUs to provide leadership in organizing weekly phone calls with their superintendents and with other community providers as well to keep folks informed on what's happening and what the latest is, and so we can keep track of what's going on across the state. I know the leaders that are actually standing up here, the education leaders and the leaders in the room, are having so many conversations about what's right for them. I absolutely support when you make a decision about what you believe is right for you, that's the right decision. I'm also saying that as we look at this and we work together to assure the safety and the best planning possible and ensure that we're able to operate as normally as possible when we can, that happens. And by the way, that disrupts very quickly, as we saw yesterday. That change happens fast. We want schools to be ready to provide leadership in their communities, and you're doing that. We want schools to be in a position where they can continue to offer some sense of normalcy for their families, including our concerns about food, and reaching out and being able to prepare that. I've had so many conversations with so many leaders across the state of Nebraska about how that's going to be done, and we'll continue to do that work as well. What I can absolutely promise to you that the concerns about rules and regulations are not your concern. Your concerns about what's good for your families, your children, your communities, your concerns about working with your mayors and with other community leaders, your concerns about making that happen. And I'm so proud of the response of schools and the level of care that is taking place from private schools to public schools to communities. And this is our moment to pull together to ensure the safety as best we can for our families relatives, for all of us that have people that we know are close to us that are vulnerable. Now, what I can tell you ultimately in the end, I don't know how this necessarily works, but we're dedicated to meeting next week and continuing those different meetings to ensure protocols on what else we might need to do. Given the last 2 days, if I could predict what's going to happen next week, I also would like that person to come forward, by the way. If I could predict what was going to happen next week or even yet today, I don't know. I want everyone to understand how serious this is. I get pushback, and I do see Jay Beller in the room, by the way, and we got a lot of pushback on Wednesday for suggesting that we would not let fans into that event. Mayor Gaylor Baird, thank you for your leadership on that front as well. The reality is this is rapidly moving. We're making rapid decisions, but it's for the public good and the public interest. I want to say one thing about parents. I'm a parent. It's a tough scenario, right, for all of the parents that are out there. We're worried about our kids. Our schools are both things for us, right? The place where we're concerned that if they go there, they might get sick. It's also the place where parents are saying, if I don't have them go there, I don't know how they'll be safe. So we have both those environments at work, and we're going to need your leadership across the state, and I'm going to work with every single one of you. I'll continue to do that work. We're very dedicated to that. I'm very proud of school leaders in the state. I'm very proud of the 3 that are going to speak, but I'm proud of all of you for the decisions that you're making that you believe are right for your district. So thank you. I don't know, are you turning it back over to them,
Let's start with
Governor?
Dr. Logan next.
All right.
Good morning, everyone, and
Sit down now, because you talk back. We're going to be here a while.
I like that protocol.
thank you, Governor Ricketts, for your leadership and inviting all of the superintendents who are here today. I will share that in a moment of levity, we were yearning for a snow day call. And I don't say that to diminish the seriousness of this situation, but the superintendents who are in this room, and there are many, have shown themselves to be the best and the finest in Nebraska in terms of their care about this issue and leading their school communities with integrity and with resolve. The health and safety of our students is our first priority. We, in the Omaha Public Schools, have been on break during the last week, as well as at least one other district who will speak later. We began planning for a range of community responses to COVID-19 a few weeks ago, in case we would be needed or called upon or was necessary for us to respond. The information is changing so rapidly. During our spring break, information changed hour by hour and sometimes minute by minute. We value our close relationship with local and state officials and the health experts that have supported us. Beginning a closure Monday allows us to continue the close coordination with public health officials, the Nebraska Department of Education, the City of Omaha, and the state to best respond to the evolving situation. It is an important decision. It was carefully considered and weighed. We will reassess the situation later this week to determine next steps in consultation with local and state partners. We are continuing to engage our students through any length of closure. We will certainly do our best effort. We have also worked closely with our community partners on ensuring that those students who have food insecurity will not experience a disruption in at least having a source for food and other things that they may need. Thank you so much, and I appreciate the invitation.
Thank you, Dr. Logan. Dr. Sutton?
Well, good morning. Thank you, Governor Ricketts, for organizing this. Yeah, I apologize. We appreciate the opportunity to share today. So I'm going to talk about this from just a little bit different angle. We closed today, and we will be on spring break next week as the Millard Public Schools are, so we have some time to figure this out. But the intensity of what is occurring in the community is driving a lot of the decision making. So I want to talk about this from a point of a parent for a second. After talking to many of them in the last couple of days, it started on Wednesday when NSAA said no fans in basketball. That was really the tipping point in our community that really got the attention, because everything had been national and now all of a sudden we were localized. And particularly this year, because we have really, really great basketball that is going on in our state, people were, shocked. It must really be serious if we can't go watch those kids play. And then we watched the College World Series cancel. We had announcements that the University of Nebraska was employing a different educational model, but being a parent of a Nebraska student, I know she's packing, and so there's lots of things that are happening, and they're happening so fast. And every decision that is being made by business of whether or not it's work from home, that is being made by the university, that it is e-learning, it impacts the public school, because we either have somebody that is related to somebody, or they have a child that is there, or they have an employer that is there, or they are an employer that attend our school, and then they're asking questions about, with all this happening, why are you staying open? So in order for us, at least in Millard, to stay open, there's a couple of things that we really need to have that will help us. One of them is, we need an incident command model, right? An organized, skilled, and transparent team that can communicate with the school district and the public. Here's exactly where we're at. What Governor Ricketts talked about, right? The no community spread. To have that out in the forefront for our community to understand that there is no more danger to sending your kid to school than there is for leaving your child at home. That our school is the safest place that your child can be. That's imperative to us. The second piece, we need a clear and consistent education going out to our community, right? If to sit in here and say that we have a health crisis right now, we don't have that, but we got health panic. I was at the grocery store last night. It was 45 minutes to get through the grocery line at Hy-Vee. There is no food left in the city, right? People are going out, they are buying and stocking up. There is fear that is being spread across. And if education is the great end all, then we need to together educate our community so that we slow down the fear that is occurring, because parents don't want to send their kids to school when they don't feel like their schools are safe. And that is quickly becoming the issue, is they're not feeling that it is safe because we don't have the right information out. And I'll conclude with this. This is not a response that can be done by K-12 education. This is a response in an education that must be done by business, it must be done by the university, it must be done by government officials, and it must be done by K-12 education, and it has to be the same message if we want to have a chance to keep our schools open and keep our kids safe. Thank you for allowing me to have an opportunity to share.
Thank you for this opportunity. We understand that there are many questions surrounding the Lincoln Public Schools' response to COVID-19. We know that any decision we make greatly impacts our students, our families, our staff, and our larger community. This is a decision that we do not take lightly, and our first priority is the health and safety of our students and our staff members. There are many considerations that go into making a decision such as this, and the information we are presented with, as you've already heard, changes by the hour. We are very grateful for the collaboration we have had in the open communication with various entities as we navigate new territory. We've been engaged with several conversations, meetings, and consultations with the Nebraska Department of Health, the Lincoln Lancaster County Health Department, local health officials, the mayor's office, Governor Ricketts, the Commissioner of Education, and the State Department of Education. We've also consulted with professionals from UNMC. We are also collaborating and having discussions with other school districts and higher education institutions in our own community. Ultimately, our decision to close schools will be based on the unique needs and will be made in the best interest of our students, staff, and community. Lincoln Public Schools will announce a decision this afternoon. We know that families are trying to plan. We encourage families to make plans now in the event that we do not have school next week or any of the following weeks. We appreciate the support of the Commissioner. We appreciate the support of the Governor, and thank all of you and our community partners for their dedication to help ensure the safety of our students and our larger community. Thank you.
Dr. Larson. So now we have Dr. Gold.
Well, thank you, Governor, for this opportunity. I'd like to start off by saying that just over 40 years ago, I took the Hippocratic Oath when I became a physician, as did all of the health professionals that are part of the Med Center and part of our community and part of our state. I'm also a parent and grandparent of individuals across the country who unfortunately live in areas where the rate of progression of this viral disease is uncontrolled at this time. I'm also the parent and spouse of healthcare professionals in those communities as well. So believe me, from a professional level, from a personal level, and from a family level, I get this. UNMC and Nebraska Medicine are honored to help. We're honored to help during the Ebola outbreak in 2014 and 2015. We've been front and center ever since then in the area of epidemiology, biocontainment, quarantine, isolation, policy, training, education, not just here in our state and in Region 7 that we serve, but across the country and around the world. And the healthcare professionals that form the UNMC Global Center for Health Security, the GCHS, has an international reputation for what we do on a local level, on a national level, and on a global level. And we are definitely here to help. In recent meetings in Washington, the message that I've received in every single one of those meetings is, you guys lean in. And there's no question that not only do we lean in, but we are looked at as the standard. And believe me, the decisions that we make are watched not just in our community, but across the country and around the world. And we do not take that trust lightly. The healthcare profession does 4 different things. We prevent disease, we diagnose disease, we treat disease, and we care for communities. In the instance of this coronavirus outbreak, which is truly an unprecedented pandemic, even if you were to include the experiences of 1917, 1918, because of the rapid rate of progression of this disease, unique features of the period of incubation, the fact that even though people who are looking well and feeling well can continue to carry and shed the virus, creates unique individual patient challenges and considerable public health challenges. From the perspective of prevention, the best we can do now is to educate, to screen, to use whatever pharmacologic and medical measures are available, such as vaccines and antivirals, which currently are none, other than those that are in research, and then to use what we call NPIs, non-pharmacologic interventions, things like social distancing, the things that the governor just mentioned, which include public events, schools, churches, you name it, kinds of things. On the diagnostic side, we have testing that is both specific and accurate for the presence of this virus. However, we continue to struggle with capacity, much less here in Nebraska because we do have capacity here, at least currently, but on the coasts it's become a real problem, and it continues to get better, but it's not there yet. And then we treat, and the treatment can be everything from reassurance and education to hospitalization, outpatient follow-up, inpatient care, intensive care unit care. However, there are no specific drugs, and most of the drugs and the therapies that we use are related to the complications of the disease, such as antibiotics for bacterial superinfections, use of the ventilator to support ventilatory care, etc. And then finally, we care. We care for communities. We do that through education. We do that through trying to convert fear into healthy degrees of concern and convert that concern into proactive response. We are truly at a historic moment, I believe, not just across the country and around the world, but frankly here in Nebraska as well. The communication and the relationships that the Med Center enjoys with our federal partners across all of the agencies in the executive branch, with our federal delegation, the tightness of the relationships that we enjoy with the state, with the cities, with the rural communities that we serve, and with our own faculty, staff, and students is truly remarkable, and I dare say exemplary for what other states in the United States are going through right now. If they only had the tightness of these relationships and the effectiveness of the communication, I think many of them would be in a far better state. And then finally, I would just say, I don't personally think there's any magic that goes into what the case count is or the total epidemic spread is in any geographic region of the state. I think the governor's parameters for declaring a state of emergency and for taking specific statewide action are perfectly reasonable at this time. However, that doesn't mean that local decision-making by individual schools and school districts would not be appropriate as well. So, for instance, special needs students, students who are immunosuppressed, students who have unique medical problems, students who have unique family problems, indeed, the opportunity to protect the older population, those with hypertension, diabetes, heart disease, lung disease, etc., are the name of the game here. The ultimate goal is to get through this in such a way that we don't exceed the capacity of the healthcare system of our region and of our state. And we are committed as the university, and I know the governor understands this and the mayors understand this as well, that that has got to be the goal through these NPIs, through these non-pharmacologic interventions. But if they're implemented too early, we will miss the boat. And obviously, if they're implemented too late, the boat will have left the dock for out of the sea. And so our goal is to try to get this coordinated just right. So with that, after the other presentations, I'd be more than pleased to take any questions or to take any questions offline. And again, just to say again how honored I am and how honored the Med Center is to be able to play this role at this time. Thank you.
Thank you, Dr. Gold. President Card, or Dr. Antone, sorry.
Thank you, Governor. As the state's public health authority, our main goal is to ensure the health of all Nebraskans. Just 1 week ago, COVID-19 arrived in Nebraska, excuse me, and now we have a total of 13 cases. The Department of Health and Human Services and specifically our local public health departments are leading the response. As the governor mentioned, as soon as a public or a positive case is identified, our epidemiology team at the state and the local public health departments are on the spot immediately to do the close contact and other investigations to contain the spread of the virus. So we have numerous public health experts in our state, in our emergencies, and at UNMC, which we're so glad to have. So far, as the governor mentioned, we have not detected coronavirus spreading in Nebraska in the communities. That could change, and that could change how employers and schools and communities need to be prepared. We will see more cases in Nebraska, and we need to expect closures, as we've seen, and cancellations. Businesses will be affected. Employers should be ready to implement strategies to help protect their workforce while ensuring their continuity of operations. Many businesses created their own pandemic flu plans in response to the H1N1 pandemic a few years ago. These plans should provide a solid foundation on how they can be assisted on what to do. We have ongoing and active communication with every employee is critical. Let them know the steps are being taken in your employment to try to keep the spread of the virus from happening. Employees in Nebraska are our greatest asset. We ensure policies that are going to be flexible to keep them healthy. Again, local health departments are leading the response for COVID-19 at the community level, and we will help inform the public to drive these decisions. I encourage you to reach out to your local public health departments. Employers can also find the latest guidance and other helpful information on our DHH website. All of us have a role to play in this response, and working to best maintain a healthy workforce is in everyone's best interest. And I'm going to end on an anecdote story. that we have an 8-year-old grandson who came to me and said, I'm worried, Grandpa, about the coronavirus. And I said, Jude, you don't have to worry. It hasn't really affected children or young adolescents. And then he said, but Grandpa, I'm worried about you now. I never thought of myself as old, but I think that says a lot. Yeah. Thank you.
Great, thanks, Dr. Adams. President Carter?
Good morning, everyone. This is historic times that we're in, and the University of Nebraska system, as you all saw yesterday, has made a decision to do something that we have never done before, and you're seeing this happen at college campuses all over the country. So we made the decision not just based on the abundance of being safe, but for our communities to go to remote education. Now, this is a little bit different than just online education. This is the ability that we have prepared for over a number of years of creating one IT system across all of our 4 main campuses in such an emergency that we can have our teachers, our faculty, our staff take care of our mission to educate 51,000 students, continue with that mission, and do what is best for our communities. Now, this doesn't mean that the University of Nebraska across our 4 main campuses is closed. In fact, it's quite the opposite right now. We're open. In fact, our dormitories, our housing, our food services, our security, our mental health
So I
capabilities.
just want to be clear on this. You're not going to kick my son Roscoe out of the dorms, right?
No,
He's not coming home, right?
as long as he keeps getting those good grades, Governor. So, we're trying to do everything we can to keep some sense of normalcy with our amazing mission and our amazing program that affects really, quite honestly, the entire state. And when I talk about 4 campuses, I really should talk about actually what I would say are 6 campuses, because we know our flagship here in Lincoln at UNL, UNO in Omaha, the Med Center, of course, the University of Nebraska, Kearney, UNK, but we also have NCTA, the College of Technical Agriculture out in Curtis, as well as our extension program. They touch the entire state. So we are coordinated with all the other state colleges, the community colleges, the governor's office. We did not make these decisions in a vacuum. And of course, you know that we'll be sending a lot of our students on spring break, and we'll be ready to go remote education when they return. So I want to say thank you to all our faculty and staff. And we also understand that as public school systems may close, our employees may have to go home to take care of their kids and whoever else is affected by that. We'll be ready to work across all of our employees to be remote. And should we go to a state of emergency and other campuses have to close, we'll be ready for that next level as well. For our students that are in the workforce that work for us, we're looking to take care of those. And as Dr. Gold mentioned, all the other special needs with our students, regardless of what their needs are, we're making sure that we're taking care of every individual, to include those students that are overseas and to include our students that are international students that are here with us. So again, I'm very proud of what we have been able to accomplish thus far, and we're staying plugged into the dynamics of what might come ahead. Thank you.
Thank you, President Carter. Did you want to take this with you? Do you want that? Oh, that's yours, okay. Now I'm going to bring up Brian Sloan. As Dr. Sutphin had mentioned, this is a community-wide response. And so we want businesses to be prepared and be engaged as well. And Brian Sloan, obviously speaking for the State Chamber, is going to make a few remarks along that. But what we want is for businesses to take the same steps that the university is taking, that schools are taking, which is be prepared. Be prepared for your teammates at work to maybe have to stay home because their child's home. Make sure that if somebody comes to work sick, you're sending them home. Be flexible with them with regard to their hours. Consider work at home options to be able to, again, be flexible with those parents and to help spread the virus, to help limit the spread of the virus. We want businesses to think about their continuity, as Dr. Antone was saying. We want businesses to be engaged, and then also be thinking about how you're taking care of your people. And if you've got hourly workers, how are they going to be impacted? We want businesses to exercise the utmost flexibility with the people that work with them. And with that, Brian, I'm going to turn it over to you to say a few words.
So thank you. As you've heard, businesses need to be an important partner in this process. And thank you to everybody in the education field and the health fields for taking the lead in this. As a partner, as the governor said, there are 2 prime areas. One is taking care of our own workforce. And 2, if we do have school closings, making sure that we've got appropriate planning around that. And what I would urge businesses across the state to think about is most businesses have been preparing and communicating with their employees now for some time, but that communication process doesn't stop with that. It's clear that that communication process has to be ongoing, that plans will change, that the circumstances of our workforce will change as events occur. And so what I would encourage businesses would be to do a couple things. Make sure that you always have clear plans and policies in the event that you have a teammate in your team who gets sick or others may have been exposed. Make sure that those policies are very clear and established up front. Make sure that in establishing those policies that you are in communication with your local health department, and make sure that you're very much aware of the CDC guidelines in this area. Also, as the governor noted, we will have members of our workforce, and in some communities we may have substantial numbers of our workforce, parents who have to be home to take care of a sick child or otherwise be home to take care of a sick relative. Businesses are going to have to be flexible in establishing new workforce arrangements, new working hours, new efforts to deal with a depleted workforce. It's going to vary by type of business, it's going to vary by size of business, and it's going to vary by industry. So there's not going to be one size-fits-all solution for businesses. But it's important that they have a continuity plan, and it's important that that continuity plan continue to be flexible as we go forward. And of course, as we ramp up all these efforts, businesses have to continue to reinforce the basic reminders and the basic defenses here. Remind our employees to wash their hands. Remind and provide them with sanitizers and disinfectant wipes, and be crystal clear that if a worker or anyone on your team is sick, they should not come to the workplace. Businesses are going to have to continue to be vigilant on this issue. I am confident in the business community. The response has been excellent so far. I'm confident as we go forward. Governor, I know with your leadership, and I remember the flood situation from last year, this is a state that always comes together and always leads, and I'm confident it will occur again this time. So thank you for your leadership on this issue.
Great. Thank you, Brian. Again, you've just seen the tremendous leadership that we have across the state. Nebraskans should feel assured that their public officials are working to protect the safety and health of all Nebraskans. We are a strong state, we are a strong nation, we are a strong people. We will get through this together, and we will continue to work to keep Nebraskans safe and continue to update you on the progression of this. As we know right now, again, we don't have any cases in the community that we can't track. We have been able to trace all the folks who have been identified so far with coronavirus who have tested positive back to some incident. So with that, what I'm going to do now is open up to questions and answers. Again, we're going to focus just on coronavirus. And then if you have a specific question, please, again, say your name, what outlet you represent, and then who you would like to have answer your question if you have a specific person you'd like to have answer that question. So, questions?
Governor Mike Suffer with KLC. You mentioned 200 tests. That's all the tests that are available in the state?
So right now, we have the capacity between the University of Nebraska Medical Center to do about 100 tests a day, between the Public Health Lab to do about 100 tests a day. Just to put that in perspective, so far we've only done 90 tests overall, and again, only about 10 of those have come back positive.
I guess I'm curious about the number of test kits. So you have more test kits than just 200.
That's our capacity to do those in a day. That's how many we can process in a day. Now, having said that, there are other companies out there like Quest and LabCorp that are making their tests available as well. So for example, if you go to a doctor and the doctor screens you and says, yes, you're a good candidate to be screened, you will be able to get a test, and the turnaround time for the LabCorp and for Quest right now is about 4 days. So there are other tests out there aside from what we've got. Our tests are going to be done quicker, but again, we're really going to prioritize those to people who we think are at higher risk for actually having coronavirus. For example, if they've been exposed to somebody or they've been traveling, that sort of thing. But again, if you feel like you want to talk to your healthcare provider, those commercially available tests are out there, and the turnaround time is about 4 days.
Governor, Tom Beck with Fox 42. During this press conference, reports come out that this afternoon the president's going to call a national state of emergency. I know it's early, you haven't had a chance to digest it perhaps, but does that change anything we've just heard?
No, that doesn't change anything we just heard. Again, what you've got here is the public officials across the state that are working together to keep Nebraskans healthy and safe. So we're working here. We've got a different situation than the rest of the country. We're tracking the cases of people that have been identified with coronavirus, and we're going to continue to do that. And we're going to continue to make decisions based upon the best interests of the people that we're serving. You've seen this with our school districts who have been making decisions with regard to close when they've had specific cases, starting with Fremont. And you're going to continue to see that with regard to other institutions and how they're changing what they're doing. We're going to make decisions based upon what we think is going to be best for Nebraskans.
Governor John Kipper with KMTV. Will rural communities maybe in central Nebraska or out west have just as much access to testing as they would in Omaha and Lincoln?
Yeah, so again, this would be the same sort of thing for all of our communities across the state. Right now, we're very focused because the cases have been in Omaha primarily. But rural communities, the same will, process will apply when you've got somebody who, again, if they feel like they've been exposed, they should contact their healthcare provider and public health officials, do the screening, be able to get the tests.
Governor,
Yeah.
President News, you've been criticized in the legislature by some senators who said we'd be better off as a state if we had 90,000 more people on Medicaid expansion. Senator Chambers has said he'll introduce a resolution to call it greater impeachment for failing to execute your duties. Your response to those criticisms?
Well, again, we're going to stay focused on the coronavirus here, Fred. So, right. So, again, we're going to stay focused on coronavirus here, which means we're talking about what we're doing with regard to all of our public officials to be able to respond to it. If you want to talk about Medicaid expansion, we can take that offline and talk about that later. Yeah, go ahead.
Joanne Youngshire, Journal Star. Mr. Sloan, I just want to know if there is any kind of concern in the business community about what may happen going forward in terms of businesses being hurt, restaurants, people not going to restaurants maybe, those kinds of things.
Yeah, the question is, are there concerns in terms of business impact, and particularly on what I would call the hospitality industry? And the answer clearly is yes. This will have an impact on the business community in large. Almost every industry, certainly at least from a workforce standpoint, and certainly in the hospitality industry. In the short term, there will be some impact. That's impossible to measure right now. Right now, the most important thing, and I think every business in every industry would say the same thing, the most important thing to do is what we're doing today, right now, is to prevent the spread of the virus, and that's also in every business's interest.
Is there any way to reassure people that they can still go to restaurants? Places that have.
Yeah, so restaurants are taking all the same precautions that we are in terms of increased sanitation protocols, and so yes, restaurants at this point are still safe, but I think as this progresses, I think the large events at this point nationally have been identified as things that are being addressed. So you may see some areas such as very large banquets and large food and beverage events be affected fairly immediately.
Yeah. So if I could just build on that too. So we're going to put out guidance with regard to, again, before we have that community spread, and then after we have that community spread with regard to those large events that Brian was referring to with regard to banquets and so forth. But right now, again, I want to emphasize, we don't have any of that right now in Nebraska that we've detected, right? So I was out to dinner Wednesday night with my family, went to Hacienda Real here in Lincoln. So I went out to dinner Wednesday night. I'm going out to dinner tonight. So again, I want people to take this, we want people to take this seriously. It is very serious. But we also wanted to make sure that people are well educated about the nature of it right now in Nebraska. Right now, the nature of it is we have 13 identified cases, which we've been able to track back, right? So if we have a case that we can't track, we will announce that, and we will make that public, and then we will take appropriate action for that geography. So for example, if we have a case in, say, Omaha that we can't track that would be what we would consider a community case, where just somebody in the community just got it, we don't know how, that doesn't necessarily impact Scotts Bluff, right? Because Scotts Bluff is on the other end of the state. So again, we want people to understand how this works. Go to the restaurant, make sure you're not shaking anybody's hands, right? Wash your hands before you eat, just like you would anyways, right? Don't cough on anybody. Again, all the things we've been talking about for social distancing are something that everybody can be involved with right now, today, to be able to help slow the spread of the virus.
Paul Hamel, the World Herald, got a reader question, and they ask, how will you know there hasn't been community spread if you're just testing people who come in contact with somebody or travel, something?
Well, with regard to when we know that it's actually broadly in the community, we're using that rule of thumb that I talked about. Again, that in Omaha, for example, 2 cases where we can't trace them back. Or as we have more testing, we'll be able to create more models about how that's working in the community. So we are working toward those things right now with regard to how we expand the testing. We're making those plans right now. We're not prepared to talk about them quite yet, but that is how we will go from the rule of thumb that I announced earlier today to having, say, more specific data with regard to when we have testing and better numbers and modeling. We'll be able to use that as well. But again, one of the ways we're testing or monitoring this is just people reporting flu symptoms, which the public health departments track already. So again, as I said before, if we see a spike in symptoms, but a decline in actual tests for influenza A or B, that's also going to be one of our tip-offs that we may have that spread in the community.
Hi, Governor. Cameron Silks, 1011 News. Last report, we heard that there were 11 confirmed cases. Is that still an accurate number right now?
Actually, we're up to 13 cases now. Is there one over here? Yeah.
I'm from the Journal Star, Margaret Reese from the
Wait, you guys you got 2 people here from the Journal Star? Is that fair?
We have such a large staff. I want to make sure I understand your policy as a state. If you have 1% of...
As we approach, we're not going to wait till we get to 1%, as we approach 1%.
Okay, so if you have 1 to 2 cases...
In Lincoln.
In Lincoln, that you can't track the source...
Correct.
Then you would...
That's when I will declare that we are shutting schools down, banning large public events, and so forth, and that will be for a period of 6 to 8 weeks.
Okay, that is the 6 to 8 weeks?
Yes.
Okay, and
Now,
so that's the state, but the districts can act...
Absolutely. So school districts, every school district's going to be different, right? We've got a broad geography across the state. We've got different conditions. Every school district can make that decision on their own outside of what I do if they want to do something sooner. So for example, Fremont Schools, the first school system that closed because of our patient 1 visiting Fremont and going to that basketball game. That's a great example of how a school district took action, 100% support that, to be able to address a specific on-the-ground issue.
Governor, just to be clear, if that happened in Lincoln, that should happen only in Lincoln? It shouldn't affect Scotts Bluff?
Exactly. So for example, if we do make that decision to close schools for 6 to 8 weeks in Lincoln, that would not impact Scotts Bluff. We're going to make Scotts Bluff based on a decision. And that gets back to those 17 ESUs that we have across the state, those geographic ESUs. We're going to do that, for example, for schools, based upon the geography of those ESUs.
Can I ask Commissioner Wolf's a question?
Absolutely. Commissioner?
I was hoping the governor would say no.
What's going to happen to hourly school employees?
It's been quite a conversation, I think, around the state, and I've had conversations with a couple different superintendents, and here's what I would encourage. I don't know that this was what will happen. I know superintendents have been worried that those hourly employees will otherwise not be available to them if they close. Obviously, we're concerned that the income levels of folks is part of the crisis, quite frankly. I've encouraged superintendents to look at this and school attorneys to look at this. How can you use employees that you wouldn't otherwise have to have for other purposes within the community? So when I'm concerned about how we're going to feed people, right? If we're not transporting students to schools, how could bus drivers be part of the solution to help ensure that we could do different things? How could we use other custodial staff to ensure that certain things are being done within schools, but also within the community? There might be things that we can do. Even in my own staff at the Department of Education, of which I have to go back and meet with them, right? I'm an employer as well. I have to go back and have those same types of conversations. What I've said to our staff there that have otherwise questioned whether or not they can have a place to work if we don't have a facility to work in, I'm going to say that they're working for me, because I'm going to have a lot of different things that I need to get accomplished as the state of Nebraska. So I encourage folks to do that. They have a lot of different approaches to it, but I appreciate people's leadership in making really good decisions for their employees.
One more question.
Are schools for online classes, or say they have to shut down school for 6 to 8 weeks? Would
Sounds
they
like
go
you.
computer-based, or is that something we kind of figured out right now?
First of all, it's really different across the state. So I've had texts since we've been here. What I'm encouraging schools, and I think it's a good model that the university, it's not just that you can do online, it's that you think about how to do things remotely, right? That you think about how to provide educational opportunities for our students. And we have our career student organizations that are, you know, I actually said, and I know our HOSA conference, that's our health occupations organization, I said, well, what a unique moment in time. They're actually looking at how they can do a digital conference and work with their students and provide digital curriculum at a statewide level. We might be looking for things that we can provide from a state that are going to help schools that don't otherwise have those resources. There's a lot of partnerships to be built, but we're going to continue to do that work.
Yeah, I was just saying, yeah.
I just want to add something to that because it does bring up a great question. And I want to tell you that, you know, at the University of Nebraska level, we're trying to think out in front of this. You know, this is a problem you're seeing across the entire nation. It may actually, if we're still doing this 6 months from now, not saying that we will, it may actually change the face of how we educate. And we want to get this right. We want to make sure that we're thinking through this. We want to make sure that we're going to do everything from even commencement exercises. We're looking at how would we do that virtually if we had to. So this is a question that goes all the way down to K-12, technical schools, vocational schools, in our four-year university, and even our PhD program. So where there is great challenges, there's also great opportunities here. So we want to make sure that we are thinking through this and how we can make a difference, not just for Nebraska, but for the nation and the world.
Great. Well, as you can see, again, we've got great leaders up here who are taking charge to think about how for their institutions, they're going to protect the safety, the health of Nebraskans. We will continue to update you as we all work together to be able to make sure we slow the spread of this virus, to protect our healthcare systems here in Nebraska. But Nebraskans can be confident that all of our leaders across the state are working together to putting their best interests at the utmost top priority. Thank you all very much for being here today, and we will continue to update you as we have more information about how Nebraska will address this pandemic. Thank you. All right. Thank you.